My creatinine is slightly raised from my baseline. Am I heading to a dialysis? You bring the report in a sealed calm and open it in front of us so that we can explain you exactly what is the relevance of this report. Ladies and gentlemen, I am Dr.Pratim Sengupta, Director of Nephrocare India Private Limited. Over a period of last 1.5 decade, treating more than 10,000 patients, I have seen the most common fear which prevails in the patient's mind, be it conservative care patients, those who are transplant patients, if their creatinine rises minimally, say 0.1 to 0.2 or 0.3, they start thinking all the adversities regarding their kidney health. They start panicking. They think that everything is gone. Possibly they are heading to a dialysis. Those who are transplant, they're thinking that possibly their grafts is going on. This is a very, very common questions my patient always asks to me in my clinic. In this video, I'll answer this thing to try to explain the myths about minimal creatinine rise and the anxiety and the fear which always comes to some patients' minds whenever they find that there is some rise in the creatinine. Let me tell you one thing. A simple or minimal rise of creatinine is not at all the most important thing we should look for when we analyze our kidney functions. Yes, creatinine rise is a concern, but we have to be very careful to understand why this is happening. Is there any overdose of the diuretic? Did you take all necessary precautions which is otherwise required for testing of the creatinine? For example, 6 to 8 hours fasting, not to taking too much of protein, stopping ranitidine or famotidine. Majority of the time we don't do it. And sometimes when you change the laboratories, the techniques by which the test has been done, it also has some impact on the creatinine level. So before interpreting creatinine or connecting the minimal rise of creatinine or minimal fall in creatinine along with your deterioration or improvement of kidney functions, you need to take in account a lot of factors like your hydration status, your food pattern before the test, whether you did the fasting sample or not, whether you have stopped the medicine like ranitidine, famotidine before giving the creatinine. So these are all factors which, taking on account along with the clinical assessment, we came to conclusion whether this rise or fall in creatinine is relevant or not. Ladies and gentlemen, please don't get panicked. Neither don't get too much elated if your creatinine minimally rises from your baseline or falls from your baseline. There are so many factors to be looked for to understand whether kidneys are well or not, like your appetite, your sleep pattern, your energy pattern, your moods, peripheral edemas, your overall well-being. There are so many factors. We maintain a CKD well-being score. If you come to my clinic Nephrocare, there for assessing a kidney function, we never look at creatinine at all. On the contrary, we look at a lot of other factors, symptomatic factors, volume status, some important blood biochemical tests like calcium, phosphorus, vitamin D, potassium levels, sodium levels. So taking all this account, we come to a conclusion whether your kidneys are functioning well or not functioning well. So if you find in your lab reports that there is a minimal rise in creatinine, instead of being panicked, please consult with your nephrologist or come to our clinic. We'll explain why this has been rising. If it is really a matter of concern, then definitely we'll guide you. But don't get panicked. Don't unnecessarily spend sleepless night until you show your doctors. I usually recommend to my patients, instead of seeing the report, you bring the report in a sealed calm and open it in front of us so that we can explain you exactly what is the relevance of this report. Interpreting creatinine is not so easy. It takes a lot of experience, a lot of understanding, and a lot of context on which the test has been done. Then only we can come and conclude and interpret the report. So stay healthy. Don't get panicked if your creatinine is minimally raised, or don't get too much elated if your creatinine is slightly lesser than what it was existing in the earlier time. Instead, try to analyze the entire symptomatology and also follow whatever instruction we give to maintain your kidney health better. See you in my next video. If you feel this video is useful for you or it makes sense, forward it to your friends, colleagues, and also don't forget to subscribe my channel or visit www.dearpratim.com to get a lot of information regarding my upcoming videos, podcasts, and all the other necessary blogs which I post for the patient educations. Thank you very much. See you again.